Well, Mkhize is on an oversight visit to KwaZulu-Natal's health facilities. Bonga Dlulani was with him and he joins us now. Bonga, of course, we've seen the minister take on a number of these site visits where he really tries to assess if provinces are doing the best they can to respond, at least to the rate of COVID-19 infections where he's visiting. What is the sense that the minister has been left with today?
Well, they're very confident, Zweli Mkhize, Kathy. We're at the last stop now. That is the Umhlanga private hospital in Umhlanga. So basically the minister saying that he's very impressed with what he's seen here at all the public and the private hospitals he's visited. The minister is saying that, yes, there are issues that need to be dealt with, particularly in hospitals when it comes to beds and also ICU, and that the most crucial issue right now is the issue of oxygen tanks, that they need more because people seem to be presenting at health facilities or going there at a late stage when the symptoms have progressed to such a point that they cannot be helped and that they pass away. But all in all, he's a minister who's very comfortable saying that he's happy with the way things are going right now. He talked about all that important vaccine, Kathy, saying that the 1.5 million doses are on schedule and that this week, we should have this week a date as to when we can expect them, saying that he'll also quantify the cost because things do seem to change. But now, assessing these facilities, he says, yes, there's issues of beds, yes, there's issues of staff shortages, yes, there's issues that need to be dealt with on a daily basis. But for now, there's no crisis. He's not overly concerned because it seems the KwaZulu-Natal government, even though we have the highest number of active cases in this province, they know what they're doing and is impressed with how they're responding to COVID-19. And it's very optimistic too that while we're in a surge, a growing surge, it's not time to say that things are getting better, but he's hopeful that in the next few weeks, he didn't give us an exact time, his estimation also Kathy, that things will begin to come down and we'll see a decrease. But he's saying that again, that's how they're monitoring, that's how their scientists are telling them. And also he wouldn't go into be saying there's a certain date that can happen, but he's happy that they're hoping that the surge will stabilize and then we'll see numbers decreasing because they are in the 18 and the 20,000s daily number of reported cases and also deaths. You know, they're also in the 3 numbers of 400 somewhere. And KZN is one of those hotspots, those provinces that have been identified with so many issues, particularly people not responding and also not presenting themselves early at health facilities so that can help sooner, so they self-isolate and go home, many of them having to be hospitalized and others unfortunately dying at these hospitals because they didn't come forward sooner.
Bonga, community transmissions are also a big issue. Was the health minister made aware at all about the water shortages and the water supply issues that several parts of eThekwini have been facing over the last couple of weeks? And I'm interested to know if there's anything that he can do to assist there.
He brought up that issue, Kathy, and particularly also electricity too, how some of load shedding contributes to maybe hospitals, the generators maybe not kicking in. There's reports that people are dying because the hospital generator didn't kick in, but he was saying that we need to investigate that first, not saying that they're confirming it happened, but he did allude to the fact that infrastructure at public hospitals, it's something that's always been a historical issue, and that right now with COVID-19, they need to ensure that infrastructure is not something that hinders the public health care offered to people who come to public hospitals, particularly because private hospitals are somewhat on their own, but he was referring to that issue. He also did mention that, Kathy, just to say that he's aware of the alcohol ban. People are angry about it, but he wanted to come to the point that the way that it's freed up space is that people are free to help people more in the trauma units they can use for COVID-19. So bringing that again, saying that it is important that people understand that sacrifices must be made, but because of the infrastructure is so limited and that the alcohol ban is there, they've been able to insert that the existing COVID-19 cases first. So he did allude to the fact that they still have staff shortages, they have infrastructure issues, historical infrastructure issues, and that national government, he wants a report from the MEC here to write to him to tell him what are the biggest challenges that he, the national government, can assist with. And then he'll present it to the government, he'll present it to the National Command Council and the president to see where they can assist, because that's what he wants to do here. He wants to be able to lend a hand, particularly now at this crucial stage where we'll see schools reopening again, where we'll see tertiary universities also going to open in the next coming months. So the minister saying that the hospitals must not be overburdened, but at the same time, he does not want small issues which are such as staff posts not being filled, where staff are being overwhelmed because too many people, and there's short of doctors and nurses, and that he wants those issues to be solved so that the focus could be COVID-19. But he did say he wants a report, a complete one, where national government can intervene, then they'll intervene.
All right, Bonga Dlulane, let's leave it there for tonight. He's out in KZN with the health minister.